On my personal pages, I like to talk politics, and I could foreshadow the way politics was going to cause a migration of sorts in the states, from restrictive states to more liberal states. And I knew that this was going to happen as far as like younger women who are trying to choose colleges because that is an escape. So back in November of last year, I said that young women were going to choose more liberal states to go to college. The birth rate was going to continue to drop. The GOP was going to age out. The religious nuns were a growing group, so that means that the liberalization and religious nuns were going to keep making people go blue. And if you look at this post of mine, you'll see that I was talking about the brain drain, women leaving red states, and what's going to happen with these red states as more people decide to leave red states for blue states. People don't understand history. A lot of conservatives are anti history and anti education. It is apparent because the Great Migration happened between the 1910s and the 1970s when Jim Crow forced Black people out of the South and into the West and Midwest and North. That is what happened. Millions of people left the South because of Jim Crow and sharecropping and that kind of thing. And that is precisely what is happening. You're going to start seeing migration patterns that are changing. And it's not just going to be women, it's going to be the physicians. And I've talked about this, and I'm going to do more. I'm going to do another post. It's going to be the physicians that care for people. It's going to be gay people. Is going to be There's going to be an exodus of people that are allies to women, that actually like women. Because once women start to leave, then the men will be left with places like that have sex imbalances, like in Asia. Because once the women leave, it's just going to be a bunch of men. So at some point, people should pay attention to this, but they will not pay attention because it's going to be a trickle effect. And then you won't notice it until all of the folks are gone. There will be more coming. Now, let's talk about the brain drain that will happen in states that have restrictive reproductive care. Doctors face tough decisions to leave states with abortion bans. Let's get into this one. Dr. Nicole Teal, a maternal fetal medicine specialist, had just finished her training in North Carolina when she was offered a good position with the state that would have allowed her family to stay closer. But there was one problem: North Carolina's 12-week abortion ban. She has chosen to move to California. Being able to provide abortion care after 20 weeks is really fundamental to my practice and comes up for me on a weekly basis. Teal says she often diagnoses fetal anomalies, sometimes between 18 and 20 weeks of pregnancy, because many anomalies cannot be seen earlier in pregnancy. Providing abortion care could come even later. So, this is medical care, and now people are running the doctors away. Patients often do not develop high risk conditions until after 21 weeks of pregnancy. It's really put me in a position of moral distress on more than one occasion. In interviews with ABC News, physicians in Texas, North Carolina, Ohio, and Florida said they decided to leave their states due at least largely to the impact abortion bans have had on their ability to practice medicine and provide the best care possible for their patients. New doctors are avoiding states with restrictive bans. So this article is from Axios. New doctors avoid residencies in states with abortion bans. OBGYN programs are down 5%, and the total specialties is down just under 2%. So there's a bigger impact on OBGYN programs. So this graphic shows how much OBGYN programs are down. Places where it's banned, OBGYN programs are down 10.5%. Where there is a limited 6-week to 22-week ban, OBGYN programs are down 6.4%. And where it's legal after 22 weeks, it's down just over 5%. Whereas total specialties are down just over 2%. Just under 2%. Why does this matter, and why should this scare people? Because people apply to residencies where they plan to live. And if, particularly for a drop in OBGYN, that's going to impact people women overall who want to have kids. And in some of those states, the rural states, they already have the highest maternal mortality rates in the US. So the AAMC found that states with near total abortion bans saw a 10.5 decrease in OBGYN applicants who were MD seniors this year. That is going to impact people overall. People pick states that they plan on living in. So if medical doctors don't want to come to your state, people will be screwed. These states, these politicians, and these regular Republicans who want to restrict people's behavior based on their belief system will push people away. So this is another article that I came across. We are not going to win that fight. Bans on abortion and gender affirming care are driving doctors from Texas. So let's get into this one. Okay, so let's get into this one. Ali Reza Shamshirzad, please forgive me if I mispronounce, a maternal fetal medicine specialist, had lived in Houston for 10 years. He and his wife owned their home, and both of their children had been born at nearby Texas Children's Hospital. Texas was home, but when the state implemented a 6-week abortion ban in September 2021, almost a year before Roe was overturned, everything changed. As someone who specialized in complex pregnancies, Shamshirzad frequently saw reminders of just how far-reaching the abortion ban was and how dramatically it compromised his ability to provide needed medical care. One day, he recalls he treated a woman who was pregnant and excited to welcome twins, but one fetus began suffering complications, and the other's amniotic sac ruptured. There was no way she would be able to give birth to a live baby. But at 15 weeks pregnant, she was too far into her pregnancy to have an abortion unless her life was clearly in danger. Imagine what that woman was going through because of these supposed pro-life people who are they're just passing laws that lack humanity. Medically, he knew what the right course of action was, but legally, there was nothing he could do. He sent her home, telling her to return if she developed a fever or chills. When a few days later, the woman came back, she was in severe danger. She had developed septic shock, a condition that involves extremely low blood pressure, mental confusion, and in some cases, organ failure and death. They cared for her in the intensive unit for 2 weeks. The infection was so severe that the patient's kidneys suffered. So now she has all kinds of issues because of this abortion ban when this doctor knew what he should have done. And now she's going to require a transplant. All of this could have been avoided if he would have been able to give an abortion, and that's when he realized that this was too much. In June 2022, just weeks before the Supreme Court overruled Roe, he left Houston taking a hospital-based job in Boston. Now he said he's not sure he will ever go back. I want these pro-life people to understand what you guys are doing to yourself. But if you want to compromise the lives of people, the health of people, simply for these culture wars, then continue. Y'all jump in the comments and tell me what you think. Like, comment, share.